Welcome to the Pediatric Review, where I help you prepare for your pediatric nursing exams. If you would like a copy of the study guide, you can find it on my website, blossomwithjessica.com. So now we're going to talk about eyes, ears, and throat disorders. So the first disorder is conjunctivitis. This is caused by an allergy, trauma, bacteria, or viral conjunctivitis. It's very contagious. Signs and symptoms are redness, edema, discharge, and burning. And our nursing interventions are hand hygiene, do not share towels, antibiotics or antiviral eye drops or ointment, no school or daycare until 24 hours after antibiotic administration, and avoid rubbing eyes, wearing contacts, or wearing eye makeup. Then we have otitis media. This is a common complication of a respiratory infection, common in children due to a shorter, wider, and straighter tubes. These are the tubes within their ears. I'm not actually sure how you say it, but this is a key thing. You could get a question about this. To prevent, we feed infant upright, breastfeed for the first 6 months, avoid smoking, and maintain immunizations. Signs and symptoms are fever, ear pain, and crying, no appetite, head rolling side to side or pulling on their ear drainage, red and opaque tympanic membranes. When we look in their ear, the membrane that's in there is red. Nursing interventions, we want to encourage fluid intake, local hot or cold to help relieve discomfort, clean drainage from external ear with sterile swab and gauze, administer antibiotics, analgesics. In infants over 6 months, usually wait 72 hours before antibiotics to see if it will spontaneously resolve due to concerns about medication-resistant streptococcus pneumonia, and screen for hearing loss. And in children 3 and under, we want to pull the pinna, so the top of the ear, back when giving meds. If they're older than 3, we want to pull it up and back. So again, under 3, we pull the pinna down and back. And if older than 3, we pull it up and back. Then we have tonsillitis and adenoitis. So tonsillitis is the inflammation and infection of the tonsils. Adenoitis is the inflammation and infections of the adenoids. Signs and symptoms are recurrent sore throat, enlarged red tonsils that may be covered in white, difficulty swallowing, unpleasant breath, cough, and fever. Nursing interventions pre-op are to assess for signs of infection, bleeding, and clothing labs because throat is vascular. Oh, and clotting. Sorry, that's supposed to say, and clotting labs. Okay. Assess for any loose teeth to decrease risk of aspiration during surgery, and position prone or side lying to facilitate drainage, and monitor for signs of bleeding and have suction equipment available. We also want to discourage coughing, blowing nose, or cleaning throat, have antiemetics, clear, cool, non-citrus, non-carbonated fluids, avoid milk products, soft foods for 1 to 2 days, do not give the client straw, forks, or sharp objects, and monitor pain. Low-grade fever and ear pain may last a few days. Then we have epistaxis. This is a nosebleed. We do not put the patient in a laying down position due to the risk of aspiration. We want to remain calm, keep the child calm and quiet, have them sit up, lean forward, apply continuous pressure to the nose with thumb and forefinger for at least 10 minutes. And if bleeding continues, insert cotton into each nostril, apply ice or a cold cloth to the bridge of the nose. If you would like a copy of the study guide, you can find it on my website, blossomwithjessica.com.